Now, the law says the United States Healthcare Preventative Task Force makes this decision. The Secretary decided that she would go outside this, and she developed a set of guidelines along with the National Institutes of Health. I'm not saying any of these are bad. I just want you to see that this was a political thing taken out of what the law authorized, and authorized by a different group. Well woman visits, these are all covered as 100% coverage as preventive health care. Screening for gestational diabetes, HPV screening, HIV screening, STD screening. This one you've heard a lot about because of the controversy with the Catholic Church in particular. Contraceptives, sterilization and counseling, breastfeeding support, supplies and counseling, and domestic violence screening and counseling. These were all added to the 100% coverage as female preventive health care. You all can make your decisions about whether you think those all should be covered 100% as preventive care. What I noticed was that 5 of those are lifestyle related. That's why I said our sociological and moral culture has affected the way we spend money on health care. Now, I am not saying we should ignore people who develop HIV. That is not what I'm saying. I am only saying that this has affected the way we spend money on health care, the fact that we have a different norm in America. I want to share a story with you about a beautiful young lady. This is Bethany Pearson when she was 16. Bethany was driving a car in which her sister Hannah, 15, and another girl were with her. They had just come from a movie, and they got T-boned by a pickup truck. Hannah died at the scene. Bethany was severely injured. The other girl was severely injured. A paramedic showed up, and within 34 minutes they had her in Gillette's Children's Hospital in St. Paul. What an incredible feat for them to do that so quickly. They called her mother and father and they said, "Come to the hospital, your daughter won't make it through the night." I cannot imagine what it would be like losing a daughter. I cannot imagine what it would be like losing 2 in the same night. This is Bethany a year and a half later riding her horse. Bethany loves the American healthcare system, believe me. It saved her life in so many ways. This horse that she's riding is a horse designed to help people with brain injuries so they can get their sensory things back working right. She now ministers to other people with brain injuries. Bethany is now 22. She's a college student with some learning disabilities because of her brain injuries, severe. She has lots and lots of surgeries, remarkable young lady. I asked her mother, how in the world did you pay for all of this? And this was her mother's answer immediately. Insurance paid for most of it. Private health insurance paid for most of it. There was some that was done by charity. There were some other programs that she was able to avail herself of. About $890 billion in healthcare spending comes from private insurance. You might have thought of the $2.6 billion, a lot more would be private insurance. It's not. About a third of it is. So we could take that third of private health insurance payments out of the American system and do what other countries have done and go to a government-controlled, government-funded healthcare system, and we would be spending about the same as Canada. We'd be spending a little more than the United Kingdom because they only spend about 7 or 8% of GDP, but Canada spends about 10%. Germany spends about 11.5%. Their spending trends are at least as great as ours. Everybody wants health care. It doesn't make any difference where you live. This is Dr. Lee Carisco. He was born and raised in Canada. He became a doctor there, emergency doctor, and then a family practice doctor. He eventually became head of radiology at Thunder Bay Regional Hospital in Ontario, where he and 2 other radiologists were charged with caring for 240,000 people. That's 80,000 people per doctor. American Board of Radiology recommends 1 radiologist for every 13,000 people. Dr. Carisco became very distraught working in the system. He especially became distraught because part of his job was to triage people who came in and needed an MRI or needed some other scanning service, and his job was to decide who needed it now and who could wait 13 months because that was the average in his clinic for a routine MRI. It almost killed him, literally, trying to do this work. he needed more services. And so the provincial government there gave him the opportunity to add 20 more hours of clinic time, but they didn't staff it. And so those 3 doctors then were working literally, 8 to 8 every day, 8 to 9 every day. He came to the United States. His father and mother were in a rollover. This is not really the van they were in. This was 3 years ago now. And I only put that up because of what happened with Bethany, just as a comparison. His father was a retired judge. His mother was a retired teacher. They were picked up by paramedics, and this is the email Lee sent me about it. No doctor assessments, no CT scans, no x-rays, nothing. The paramedics just dropped them off at a hotel in White River. Welcome to Canadian healthcare. Lee wrote a book called Health Reform, The End of the American Revolution, ? And the reason he wrote that was coming to Canada as an expatriate and participating now as he does as a radiologist in the Twin Cities. He sees what a great country we have and the freedoms we have, and he's very concerned that we're going to lose those. And so he wrote that book. I know the book well because I helped him write it, and I published it. So the option is, this is an option, that we could go to government-run health care. That would be another way of distributing health care, where governments decide how much health care you get, what kind of health care you get, and under what conditions. Under the Affordable Care Act, that's called the Independent Payment Advisory Board, a 15-member board appointed by the President with advice and consent of the Senate. Once it's appointed, it is self-appointed. After that, they decide how to spend the health care dollars for what and on what procedures, if we don't stay within spending targets. That's the Independent Payment Advisory Board. In Canada, well, this is what happens.
Lindsay McCreath, a retired body shop owner from Newmarket, Ontario, began having headaches and had a seizure in January of 2006. Both he and his doctor suspected a possible brain tumor. He needed an MRI fast. How long was the wait?
4 months before we could get our first MRI here in Ontario.
So in their hour of desperation, the McCreaths called private medical broker Rick Baker.
Bear in mind, if you have a suspected brain tumor, it's really important you find out if in fact you do have a brain tumor. And beyond that, it's very important to find out if it's malignant or if it's benign. They were waiting 4.5 months to get this, an MRI. Came to us on the 2nd of February of 06. On the 3rd of February, they were down in Buffalo. They got an MRI, which indeed showed that Lindsay had a brain tumor.
He had a mass in his brain that was the size of a golf ball.
He came back to Canada with his MRI in his hand, went to see his family doctor. He was given a May the 27th date to see a neurosurgeon. Now this is back on the 3rd of February.
I was angry at the waiting of 3 months.
He didn't want to wait till May the 27th, knowing he had a tumor.
The surgery was scheduled for within a week's time.
Lindsay McCreath got his brain surgery in the U.S. The results of the biopsy? Cancer.
If that had been a class 4 astrocytoma tumor, he would not have made it. He would not have lasted 8 months. He would have, in all likelihood, have died.
My father passed away a few months before this happened, so we happened to have the money there. But if we hadn't, I would have put a mortgage on a home to go for the surgery across the border rather than wait 6-8 months, which is ridiculous when your life is threatened.
Now I understand that there is a movement afoot in the U.S. by in certain circles to try and duplicate the Canadian system in the U.S., trying to adopt a single payer system in the U.S. Then where will I send my clients? I'll have nowhere to send my clients. Your hospitals will be backed up. You people will be waiting 2 and 3 years for surgery. I'll have nowhere to send Canadians.
You know what's remarkable about that? When we first looked at this video, of course, we were astonished. And in Canada, if you have a situation that's covered under the provincial plan, it's illegal for you to use your own money to pay for that service. You can't go to a doctor in Canada and say, please, I'll pay for this myself. It's illegal. That's what she was saying. So the only place she could go was out of the country. She could have gone to Costa Rica or India. I mean, there's a lot of places they could have gone. They come to the United States. But under our Medicare system, it's also illegal if it's a covered procedure and you don't get a waiver from the doctor to go and do it at another doctor. It's illegal for you to spend your own money on your own health care. So in a sense, we've already got that going in our Medicare system here in the United States. And I remember being really critical of this, and then we learned this about Medicare. We thought, my gosh, I didn't know that. Well, here's where we're headed. Under the Affordable Care Act, the idea is to pull together the practice of medicine into smaller groups called accountable care organizations. Accountable care organizations, or ACOs as they're known as, will take physicians and surgeons and pharmacies and radiologists, and they'll take hospital systems and clinic systems and put them together under one roof. I know some of the old doctors call it HMOs on steroids, but it's a little bit different because they're doing a lot of categories of care, episodes of care, especially chronic care for diabetics and people with certain heart diseases and so forth. The idea is they'll make a payment into the system, kind of like they do with Mayo Clinic, a payment into the system, and then that money will be distributed, providing care for that individual. Now, the doctors that I know, I'm on the board of the Minnesota Physicians and Patients Alliance, and these are all the conservative doctors who don't like the imposition of lots of controls on them, so that's their bias. But they say in order to get this passed, the law required a waiver of federal antitrust laws because inside the ACO now you have a trust issue where they're dominating care and setting prices, so they had to have a waiver of antitrust. They had to have a waiver of the violation for self-referral. That's what it means when a doctor says, come back tomorrow so I can charge you another fee, if I could say that bluntly. Or waiver of fee splitting. That was another thing that had to be in the bill. What fee splitting is when the doctor says, go over to my MRI clinic over there, or go over to Dr. Smith's MRI clinic, and I get a bump for sending you over there. That's illegal. You can't do that. But under the ACOs, you're going to be within the same system, so they had to waive those things. Then there's also the reduction in provider reimbursements. You've been hearing a lot about this in the news. $716 billion is being taken out of the Medicare system, and we're being told that that's not really a reduction in spending. What it is a reduction in how much doctors get paid and hospitals get paid. There's a projection that 1 out of 6 hospitals will close as a result of that, and doctors, of course, are reluctant to work for less pay. It's just not in your normal genes to do that, and doctors complain constantly that their Medicare reimbursements already are at about 40% of what they really need, or 40%, less than what they need to break even in their practices. And Medicaid is worse, health care for the poor. About
waste and fraud, they were saying.
Yeah, waste and fraud, you bet.
I know.
You betcha.
Why did they just decide to do that now?
That's a good question. By the way, you bring up waste and fraud. There's one of the articles that we wrote, between 75 and 175 billion. Listen to that number: 75 and 175 billion dollars fraud in the Medicare system, in the Medicaid system. And if we could just, and organized crime is involved in fraud in that now. Anyway, that's the ACO. And then this is what's happening with insurance companies. There were 1,300 competing insurance companies that were members of the Association of American Health Insurance Plans, which is their national association. And I kind of, there's the big one and the local one and the innovative one, and there's the best one, and there's the one for kids, and here's the new one on the block. But what's happening is these companies are now being absorbed. In fact, in the second quarter of this year, there were $61.2 billion in acquisitions, mergers and acquisitions among these insurance payers and providers coming together. One of the unique things about Minnesota, Mike Hatch, when he was Attorney General, worked hard to break up the Alina system because you had payers and providers under the same system. Under the Affordable Care Act, we're bringing them back together again. That's rather unique. But this is really where we're ending up with insurance companies. Fewer companies maybe becoming more like a national utility.